Welcome to this comprehensive training program on restrictive practices in aged care. This is a crucial topic for anyone working with older adults in Australia. Our goal is to provide you with the knowledge and skills to provide the best possible care while upholding the dignity and rights of every individual. Throughout this training, we will delve into the complexities of restrictive practices. We will explore the legal and ethical considerations surrounding their use. Our focus will be on ensuring the well-being and safety of our elderly population. Let's begin our journey by defining restrictive practices and understanding their significance in aged care. Restrictive practices encompass any action, measure, or procedure that restricts an individual's freedom of movement, choice, or behavior. These practices can manifest in various forms, including physical, chemical, environmental, mechanical, and seclusion. Physical restraint involves the use of physical force to limit someone's movement. Chemical restraint refers to the administration of medication to control behavior, not for medical reasons. Environmental restraint restricts someone's access to their surroundings, limiting their freedom of movement. Mechanical restraint employs devices to restrict movement, such as belts or vests. Lastly, seclusion involves isolating a person from others. It's imperative to recognize that all forms of restrictive practices have the potential to impact an individual's well-being significantly. Understanding the different types of restrictive practices is paramount. It enables us to identify potentially harmful situations and intervene appropriately. In the following sections, we will delve deeper into the legal and ethical framework governing restrictive practices in Australia. Navigating restrictive practices in aged care requires understanding Australia's legal framework. Key legislation safeguards the rights and well-being of older adults. The Aged Care Quality Standards set benchmarks for care quality. Standard 8 focuses on minimizing restrictive practices. The NDIS also regulates restrictive practices for persons with disability. Compliance ensures the well-being of those in our care. Beyond legal requirements, ethical considerations form the bedrock of responsible aged care practice. The use of restrictive practices presents a range of ethical dilemmas that demand careful consideration. At the heart of these dilemmas lies the balance between ensuring an individual's safety and upholding their autonomy and dignity. The principles of beneficence, non-maleficence, justice, and autonomy guide our ethical decision-making. Beneficence compels us to act in the best interests of the individual. Non-maleficence directs us to avoid causing harm. Justice underscores the importance of fairness and equity in our actions. Autonomy emphasizes an individual's right to make decisions about their own lives. When considering restrictive practices, we must weigh the potential benefits against the potential risks and infringements on individual rights. This requires a thorough assessment of the individual's needs, the risks involved, and the availability of less restrictive alternatives. Ultimately, our goal is to provide care that prioritizes the individual's well-being while upholding their fundamental rights. Ethical decision-making is an ongoing process, requiring ongoing reflection, open communication, and a commitment to acting with integrity. The use of restrictive practices in aged care intersects profoundly with the fundamental human rights of older adults. The Universal Declaration of Human Rights, along with other international and Australian human rights instruments, provides a framework for understanding and protecting these rights. Central to these rights are the principles of dignity, respect, and non-discrimination. Every individual, regardless of their age or abilities, has the inherent right to be treated with dignity and respect. This includes respecting their autonomy, privacy, and freedom from cruel, inhuman, or degrading treatment. Restrictive practices, by their very nature, have the potential to infringe upon these fundamental rights. Therefore, their use must be approached with the utmost caution and only as a last resort after all other options have been exhausted. When restrictive practices are deemed absolutely necessary, it is our duty to ensure they are implemented in a manner that minimizes harm and upholds the individual's rights to the greatest extent possible. This includes obtaining informed consent, monitoring their use closely, and regularly reviewing their necessity. Physical restraints. Physical restraints involve using the body or parts of the body to limit or restrict a person's freedom of movement. These can include holding a resident down or physically preventing them from moving. Restraints should be an absolute last resort to prevent immediate harm. They carry significant risks, including injuries and psychological trauma. Our goal is to create a safe, supportive environment, prioritizing well-being and dignity. Embracing less restrictive approaches fosters autonomy and respect. Chemical restraints. Chemical restraints involve administering medication to control behavior, not for treating a diagnosed condition. Medications can be essential, but using them as restraints raises ethical concerns. It's crucial to distinguish between therapeutic use and misuse as restraint. Side effects can range from drowsiness to severe complications. Medication use should prioritize well-being and autonomy. Environmental and mechanical restraints. Environmental restraints can significantly impact an individual's freedom and well-being. Examples include locked doors, enclosed courtyards, or electronic monitoring systems. Mechanical restraints use devices or equipment used to limit or restrict a person's freedom of movement or access to their own body. Examples include belts, vests, bed rails, or specialized chairs. These restraints may prevent falls but can lead to isolation and frustration. Reduced mobility can decline physical function and undermine independence. Conduct thorough risk assessments and consider less restrictive alternatives. Focus on maximizing freedom and independence while ensuring safety. Seclusion, as a form of restrictive practice, involves isolating a resident in a room or designated area from which they cannot freely leave. This practice is typically used in situations where a resident's behavior poses a significant risk to themselves or others, and where other de-escalation strategies have failed. The seclusion space is often a room that is free from hazards, providing a controlled environment to help manage the resident's behavior. However, seclusion should only be used as a last resort, and its use must be strictly monitored and documented. The resident's physical and emotional well-being must be continually assessed, and they should not be left in seclusion for longer than necessary. Additionally, the decision to use seclusion must be made with careful consideration of the resident's rights, and wherever possible, with informed consent from the resident or their legal representative. Regular reviews and clear documentation are essential to ensure that seclusion is used appropriately and in accordance with legal and ethical standards. In Australia, the Aged Care Act and Aged Care Quality Standards safeguard the rights and well-being of older adults. These standards ensure high-quality care that is safe, respectful, and tailored to individual needs. Restrictive practices should be minimized and used only as a last resort. Standard 8 mandates robust systems for appropriate use of restrictive practices. This includes clear policies, comprehensive training, and regular monitoring. A person-centered approach ensures restrictive practices are a last resort. Adhering to these standards demonstrates a commitment to ethical and respectful care. Informed consent and meticulous documentation are cornerstones of ethical practice in aged care. Ensuring understanding, open communication, and regular review are key. Meticulous documentation records decisions, rationale, and effects. It ensures accountability and transparency, protecting all parties involved. Recognizing common triggers. Understanding why challenging behaviors occur is crucial in aged care. These behaviors, often a way for seniors to communicate unmet needs, can stem from a variety of triggers. Recognizing these triggers is the first step towards addressing them effectively and providing person-centered care. Environmental factors often play a significant role. A noisy or crowded space can be overstimulating, leading to anxiety and agitation. A lack of personal space or familiarity can trigger feelings of insecurity and distress. Changes in routine, even seemingly small ones, can be disorienting and lead to resistance or outbursts. Physical discomfort is another common trigger. Pain, whether from an underlying medical condition or a recent injury, can manifest as anger, aggression, or withdrawal. Sensory impairments, such as vision or hearing loss, can lead to frustration, confusion, and difficulty communicating, which can escalate into challenging behaviors. Medications can also contribute to behavioral changes. Side effects from certain medications, interactions between multiple medications, or even improper dosage can trigger agitation, confusion, or mood swings. It's essential to monitor residents closely for any changes in behavior after starting a new medication or experiencing a change in dosage. Behavioral assessment and person-centered care. Addressing challenging behaviors effectively requires a deep understanding of the individual and the triggers behind their actions. This is where behavioral assessment plays a critical role. It involves systematically observing, documenting, and analyzing an individual's behavior patterns to identify the root causes of their actions. A comprehensive behavioral assessment considers various factors, including the individual's medical history, cognitive abilities, communication style, and environmental influences. It involves gathering information from multiple sources, including the individual themselves, their family members, and other healthcare professionals involved in their care. The goal of a behavioral assessment is not simply to label or categorize behavior, but to gain a holistic understanding of the individual's needs, strengths, and challenges. This understanding forms the foundation for developing a personalized care plan that addresses the underlying causes of challenging behaviors rather than simply managing the symptoms. Person-centered care is paramount in addressing challenging behaviors effectively and ethically. It means placing the individual at the center of all care decisions, respecting their autonomy, preferences, and life experiences. This approach acknowledges that each person is unique with their own history, values, and ways of communicating. Environmental modifications, creating a supportive space. The environment we create for older adults plays a profound role in shaping their behaviors and overall well-being. Environmental modifications can reduce the need for restrictive practices and foster a sense of calm and security. Imagine a space bathed in natural light, where soothing colors invite relaxation. Familiar music creates warmth and familiarity. Comfortable seating encourages social interaction, while quiet corners provide respite. This is a necessity for creating a supportive and therapeutic environment. Simple modifications can make a world of difference. Clear signage and adequate lighting reduce confusion and anxiety. Personalized spaces with familiar objects evoke positive memories. Incorporating nature promotes relaxation and connection. It's about creating a home-like environment catering to sensory, cognitive, and emotional needs. By paying attention to these details, we create a space where individuals feel safe and empowered. Communication strategies and de-escalation. Communication is key, especially with older adults experiencing cognitive decline or sensory impairments. Effective strategies build understanding, diffuse tension, and prevent challenging behaviors. Approach every interaction with empathy and respect. Listen attentively, speak clearly, and use nonverbal cues to convey warmth. Validate their feelings, even if you don't fully understand them. De-escalation techniques are crucial when faced with challenging behaviors. Stay calm and patient to help de-escalate situations. Redirect attention to calming activities or provide a quiet space. Be mindful of your communication style. Avoid interrupting, arguing, or raising your voice. Use I statements to express concerns and offer support. For example, say, "I'm worried you might get hurt. Can I help you with something else?" Mastering these techniques creates a harmonious and respectful care environment. As we conclude this comprehensive training on restrictive practices in aged care, let's take a moment to reflect on the core principles that have guided us throughout this journey. At the heart of our work lies a profound responsibility to safeguard the dignity, autonomy, and well-being of every individual entrusted to our care. Restrictive practices, while sometimes necessary, should always be a last resort. Our primary focus should always be on creating care environments that are safe, supportive, and empowering. This involves recognizing and addressing the unique needs of each individual, understanding the triggers behind challenging behaviors, and exploring a wide range of less restrictive alternatives. Ethical care requires ongoing reflection, open communication, and a commitment to continuous improvement. It's about asking ourselves tough questions, challenging our own assumptions, and being willing to learn from our mistakes. By embracing these principles, we can create a culture of care that truly honors the rights and respects the inherent worth of every individual. This training has provided you with essential knowledge and tools to navigate the complexities of restrictive practices in aged care. But learning is an ongoing journey, not a destination. As you continue in your vital role as aged care workers, we encourage you to seek out ongoing education and professional development opportunities. Thanks for watching. If you found this video helpful, don't forget to give it a thumbs up, share it with your colleagues, and hit the subscribe button to stay updated with more valuable content. Your support helps us continue providing essential training for aged care professionals. See you in the next video.